Hi everyone, welcome to my channel. I am Dr. Ishita and I've recently completed my MD in Pathology. It's been a very long journey filled with microscopes, slides, and stains, and of course, IHC, which we're going to make simple and enjoyable together here. Teaching has always been the closest thing to my heart. There's nothing more rewarding than watching that spark in someone's eyes when a concept that once felt complicated suddenly clicks. And that is the spark that I really want to bring to all of you through this channel. Apart from my daily routine, apart from few travel insights, and apart from few study with me live sessions and whatnot. So, whether you're preparing for exams or learning in residency or you're just curious about pathology, I'm here to break things down for you in the easiest and most practical way possible. And today we are starting with IHC, and my goal is to make sure that you understand it thoroughly and it becomes your friend and not really your fear. So take a deep breath, relax, and let's dive into this world of IHC. All right? Okay. So, whenever you're reading pathology, I want you to understand that even the most difficult of topics and even the most difficult terms can be easily broken down into small pieces and just add on the meaning of those pieces together, and you'll understand what it means, what it entails, right? So, even before beginning immunohistochemistry, let's break it down to histochemistry and immunology. Okay, so histochemistry is a science which basically combines the techniques of histology and biochemistry in the study of the chemical constitution of tissues and cells, right? And immunology is a science that deals with the immune system, cell mediated, and humoral aspects of immunity and immune responses. So, moving on to the principle of it. So, immunohistochemistry utilizes antibodies and antibody based technology to basically detect and localize any specific tissue antigen. The basic principle of any procedure is that an antibody will specifically bind with an antigen to produce an exclusive antibody antigen complex. So, this bonding is used to visualize both normal as well as disease state of tissues, right? It does not mean it's only going to tell you regarding diseased tissue state, it'll even tell you about normal state, infectious agents, and other components that may not be demonstrated by our normal histochemical or special stains. So, now moving on to even more basic terms like antigen and antibody. I'm very sure you're all very well aware of all of these terms, but let's just quickly go through them before we move on to the steps of IHC. So, antigen is a foreign substance that induces the formation of an antibody, right? And bears one or more antibody binding sites. So, these are your antibody binding sites over this particular antigen. That is known as epitope, right? Epitope is a site on an antigen to which a complementary antibody may specifically react. Now moving on to antibody. So this is an immunoglobulin which is capable of specific combination with the antigen that is causing its production. So this is your antibody. It consists of 4 polypeptides, 2 identical heavy chains and light chains, right? So this is your variable region. This is joined to form the Y-shaped molecule. This stays constant in all the antibodies. Only this particular region, which is the antigen binding site, it differs from antibody to antibody. Now, these are your epitopes. This is your primary antibody, secondary antibody, and the fluorescent dye or hapten which is attached to the secondary antibody. We'll talk about this further. Now, moving on to polyclonal and monoclonal antibody. So, remember the trick that I told all of you whenever there is a difficult terminology or any term that you're not able to understand in pathology, try to break it down to 2 or more sections, right? So, for example, if we break down the word polyclonal, poly means many, right? And clonal means clones. Monoclonal, mono means one, clonal means again clones. So polyclonal antibody refers to antibodies that are generated from multiple, many B cell clones, whereas monoclonal antibody are antibodies generated from a single B cell clone. Now, polyclonal antibody recognizes multiple epitopes from the same antigen, whereas monoclonal only recognizes a single epitope because it is generated from a single B cell clone, right? Moving on to the materials which are required for IHC. Now, what are the materials required for IHC? So regarding the materials which are required for IHC, there needs to be a routine setup of histology, right? Then comes your microwave, then your reagents. So reagents include all of these reagents, which we will be reading about step by step over the following few slides. These are all the steps of IHC, and I know that fixation and processing, then block making, section cutting, deparaffinization, and rehydration. Till here, I'm hoping you're aware of all of this process, which takes up in our basic histology lab. After this process comes the main steps of IHC, starting from antigen retrieval, blocking endogenous enzymes. These are replaceable, right? We can block the endogenous enzymes, and with that, we can retrieve the antigen. The steps can take place side by side. So, if in case you're not aware and you're not able to understand the first four steps, I will be taking it up in another video as per your request. Please let me know that in the comment sections below if you want to learn that as well. So we'll be covering it up in a very short span of time, right? So after this procedure, there is non-specific antibody binding, primary antibody application, secondary application, so on and so forth. All of these steps we'll be taking up one after the other. So just imagine, right? You've gotten your tissue sample, you have fixed that tissue sample properly, and after fixing, you've made a proper block of it, you've sliced it. After slicing, there is still paraffin attached to it. So you have deparaffinized it and rehydrated. After this process comes the process of antigen retrieval as well as blocking of endogenous enzymes. So, what exactly do you mean by antigen retrieval? This is a process of treating that formalin fixed paraffin embedded tissue with proteolytic enzymes or heating them in various buffer solutions in order to expose the antigen. Now, you'll ask me, why do we exactly need to expose the antigen? See, the all antigens present in our entire tissue section are available only after they have been unfolded, right? They occur as folded molecules, and there are proteins that are cross-linked and blocking that antigen from being exposed. So the purpose is to remove the protein cross-links formed by this formalin fixation. This process allows our antigen that are difficult or impossible to stain to become readily stainable by standardized immunohistochemical methods. So, the heat causes cross-linked protein epitopes to unfold in a manner similar to our DNA denaturation, right? While buffer solutions, what do buffer solutions do? They aid in maintaining the conformation of the unfolded protein, because if you do not use buffer solutions, they might change their conformation and they might become folded again. Amongst these commonly used proteolytic enzymes are trypsin, pepsin, and proteases. See, here is the antigen which has been retrieved, and the buffer we used was citrate buffer. So the color is coming out beautifully, and here there was no antigen retrieval, right? So there is no color. Next step is blocking the endogenous activity. So blocking the endogenous activity, what exactly does this mean? There is presence of endogenous enzymes, for example, peroxidase, alkaline phosphatase. This activity is seen in many cells of the tissue, like RBC, neutrophils, eosinophils, hepatocytes, some neoplastic cells, and many more. What these enzymes do is they themselves have some form of color which they produce while we are processing our tissue. So just so that these enzymes do not hinder the activity of our IHC application, we need to block the activity of these enzymes so that we can get a proper clean color that only represents our antigen present on the tissue. For that, we use methanol H2O2 method specifically for peroxidase endogenous enzyme activity blocking. Alright, whereas alkaline phosphatase activity is blocked by 20% acetic acid. So what happens is this DAB oxidizes to brown precipitate. When this brown precipitate is formed, it gives us a false positive result, which shouldn't have happened, right? So in the case where we are blocking the peroxidase activity, what we do is we use H2O2, we block the peroxidase activity, and this H2O2 blocks peroxidase and DAB does not react. If DAB is not reacting, it is not going to create a brown precipitate and it is not going to hinder with our IHC color. Now, the third step is blocking of non-specific binding. So apart from these endogenous enzymes and apart from exposing the antigen, we also need to block the non-specific binding as well, because this is not the only binding, antigen antibody binding that takes up. There are a lot of non-specific binding also taking up in the same tissue, which can again be a problem and hinder our procedure. So antibody based applications, they rely on the specific binding of an antibody to the target epitope, right? So the same forces that govern specific interactions can also contribute to non-specific binding. That includes hydrophobic interactions, ionic interactions, and hydrogen bonding with other non-specific epitopes. Some common buffers to block these non-specific interactions are serum, bovine serum albumin, and casein. Right, so we have detection systems now. After we have finished these three steps, we have detection systems, right? What are detection systems? They allow the visualization of the primary antibody bound to the antigen that is being demonstrated with the use of a reporter label. है ना? So for everything that you need to detect, you need sort of a signal, a color, a light, any image that will confirm the presence of that X substance that you're trying to find. In this case, we are trying to find that antigen, right? That antigen needs to light up, needs to be colored so that we can see it in our slide. For that, we have detection systems, right? Those detection systems include fluorescent compounds, enzyme like horseradish peroxidase, or in short HRP, colloidal gold, radio labels, etc. So enzymes and chromosomes that we use to impart color. So the commonly used enzymes are HRP and alkaline phosphatase. So commonly used chromosomes for HRP include red and brown. Red is when AEC is used, brown is when DAB is used. So this is how AEC and DAB present, right? AEC chromosome impacts a red color and DAB gives off a brown color. This is how we'll be studying staining pattern. So cell membrane, nuclear and cytoplasmic positivity. How do they look like? This is cell membrane positivity. As you can see here, the chromosome has taken up the antigen that is depicting the cell membrane and only the cell membrane in both these slides. Whereas here there is nuclear positivity as seen in very commonly, if you've read so many times, estrogen receptor used in breast cancer, ER. This is your AAB chromosome, right? This is impacting a red color. And DAB chromosome is giving off you brown color. Stained pattern, cytoplasmic. This is how cytoplasmic staining looks like. This is keratin. This is pan positive, seen in colon carcinoma. And vimentin. Vimentin is also showing here cytoplasmic positivity. Here we have used DAB chromosome, brown color, and in vimentin we have used AAC chromosome, that is your red color. Now moving on to the methods of immunohistochemistry. There are not one, two, but there are multiple methods to perform immunohistochemistry. So few of them are direct method, two-step indirect, three-step indirect method, PAP, ABC, and LSAB method. So I'll be discussing direct, two-step indirect, and three-step indirect method with you because PAB, ABC, and LSAB are little advanced. Still, if you want to understand these methods, do let me know in the comment sections and I'll be taking up a class on this too. Starting off with the direct method, right? So here is your tissue, the tissue's antigen, and an enzyme labeled primary antibody is binding to the tissue antigen. After that, we add a substrate chromogen solution which produces a colored end product. After this substrate chromogen solution product is bind to the primary antibody. Now moving on to two-step indirect method, right? This is the indirect method. Why is it indirect? Because it does not just involve the primary antibody and the antigen. It starts to involve the secondary, tertiary, and many more other antibodies as well. So there is an unlabeled primary antibody which is binding to the tissue antigen as we've seen in the previous step. Now the addition is there is a secondary antibody to which the enzyme is attached. Now the substrate chromogen complex gets attached to the enzyme attached to the secondary antibody and not the primary one. The three-step indirect method also exists, right? You would be asking me that why exactly do we need three-step indirect method? If we have already these wonderful methods, we don't really need another method to complicate things. Well, what this does is this increases the signal and it increases staining intensity that is very helpful when we stain antigens with very few or limited available epitopes, right? Not all tissues will have n thousands number of antigen so that they are able to produce good color. So to produce good color and show good positivity, we sometimes need three-step indirect method. So here we use another layer of enzyme labeled tertiary antibody that is added to the previously described two-step indirect method. Now both secondary and tertiary antibodies, they must be conjugated to the same enzyme for this. For example, see, this is your tissue, this is tissue's antigen, the primary antibody is attached here. After that, we're attaching the secondary antibody, which is enzyme labeled. Post that, an enzyme labeled tertiary antibody is added and it binds to the secondary antibody. Now, the substrate chromogen complex binds to both our secondary as well as tertiary antibody. Now, because it is getting attached to both two sets of antibodies, now the color production will be much better and much proper. So after reading about these few steps of IHC and these few methods by which IHC is performed, we'll straight away move on to the common counter stains that are used and what are their targets. So we use Mayer's hematoxylin in our labs most commonly. The target is nucleus and the color they impart is blue to white. Nuclear fast red is used for nucleic acid and as the name suggests, it imparts red color. Methyl green is for nucleic acids as well and it also imparts a green color. Eosin, you all know that cytoplasm is the target and the color is pink to red. Now, during all of these procedures, what we see is troubleshooting. This problem that exists of weak or no staining, overstaining, and high background. All of these problems could be easily resolved because weak or no staining, the reasons could be inadequate deparaffinization, inactive antibodies, antibody concentration too low. So the very simple solutions are we have to deparaffinize properly. If the primary antibodies are ineffective, we replace it with a new batch of antibody, and the concentration is if too low, then we increase the concentration of antibodies. Same goes for our overstaining. The sources could be concentration is too high, incubation time too long, temperature is too high. So we need to reverse all of that. And for a high background, the reason why a high background occurs is when you have too many antigens and too much happening in the background to actually make you confused as if the product that we got is positive for any IHC or not positive. So that can happen because of inadequate washing of sections, tissue containing endogenous enzymes, tissue containing endogenous biotin activity, non-specific binding of primary antibody. So to resolve all that, if there is inadequate washing after every step, we need to wash at least 3 times between steps. If there is endogenous enzyme activity, then we need to block it like we discussed before, right? And if there is non-specific binding, we also need to resolve that before moving on to the next step. So yeah, our life is no longer just blue or pink anymore, right? It's colorful now because of introduction of so many beautiful IHC reagents that we have available in all of our labs. I hope you really liked this teaching session. There is a lot that I have not discussed regarding IHC yet. I only wanted to cover up the absolute basic concept of it. Please let me know if you want to have another video regarding the DAB chromogen or ABC or HRP or anything else. I would love the support and I would appreciate the comments. Thank you.